I think we all probably agree that despite the significant advances in technology and medicines over the years, we're still faced with quite staggering, if you will, serious, challenging global health issues, and perhaps they're more complex than they've ever been before. As an industry, we have an important part to play in improving health and helping us to address these issues, including by providing medicines that make a real difference to patients' lives. Our industry's aggregate portfolio of innovative medicines demonstrates our commitment to patients and treating disease, and I think we can be very proud of that commitment. But we also know that we can't do this work alone. We have an unprecedented opportunity now to work very closely with others in the healthcare community to understand their challenges and opportunities and to find out how we can combine our skills, strengths, and capabilities to drive sustainable progress in this aspect of healthcare. Now, we're only going to be able to do that if we are viewed positively by our most important stakeholders, if in fact we are trusted by those stakeholders. We must continuously strive to be trusted stakeholders. For example, building trust is one of the 4 strategic goals of the IFPMA for 2013, and to approach these complex challenges as solution partners. And that means we're going to have to work tirelessly to address our perceived weaknesses as well as build on the strengths that the industry has. Stakeholder feedback has told us that with and through the IFPMA, we have done some very important work together in both these areas over the past 2 years to build our industry's reputation as a solutions partner. Yesterday, the IFPMA Council heard a long and frankly quite impressive list of actions and activities from Eduardo about how we've done those kinds of things even in just the past 12 months. So today what I'd like to do is focus on 3 examples and also talk about one area in which AstraZeneca hopes to continue to work closely with the IFPMA and with all of you in the room to build on that good work in the years ahead. First, listening to stakeholders, it's very clear to us that our most significant challenge is our reputation. I think we all know that you can't control your reputation, but we also know that you can do your best to affect your reputation through your behaviors. It's the case in our personal relationships, it's certainly the case in our business relationships. And at the core of a positive reputation is trust. It lies at the foundation of all strong relationships. And you will build that trust and thereby enhance your reputation to the extent that you earn that trust from others. It's not something you can take for granted. So in that context, we were very pleased to see the revisions to the IFPMA Code of Practice. The Code Compliance Network, many of the members of which are in this room today, worked very hard to achieve a very important milestone. It was an important step by our industry to enhance trust, and the feedback from stakeholders has been very positive. But we know our work is not done here. Ultimately, we'll be judged by whether we walk that talk, and the code revisions are a critical piece of that foundation as we look forward to doing that work in the future. So while focusing on the behaviors that build trust, our industry also continued to do its part to tackle some of those complex issues that I described earlier. In particular, I'd like to call out our work on non-communicable diseases, NCDs, and neglected tropical diseases, NTDs. Through the IFPMA's commitment and leadership, the industry has driven significant progress on the way to becoming a solutions partner, someone who is valued and trusted with the WHO and other stakeholders in the effort to eradicate NTDs. Both the WIPO research and the London Declaration projects have demonstrated how the private sector can partner with others to support research on and development of treatments for those under-researched areas that so dramatically affect such large percentages of the world's population. Our industry has considerable skills, strengths, and resources to contribute to drive sustainable progress in the area. But it is a great example of something we can't do on our own, obviously. But these 2 initiatives provide the framework to bring stakeholders with the right skills to the table to devise the right treatments for new patients. Moving on to a set of diseases where we have significant expertise, thanks to IFPMA's leadership through the Global Health Committee, industries played a leading role in the effort to understand the current barriers that are preventing better prevention, control, and treatment of non-communicable diseases in developing countries. To a large extent, This is not an issue about developing new treatments for poorly understood disease areas. Instead, while there are many different approaches that we are required, it's about establishing partnerships to overcome one fundamental challenge identified by research, and that's to get existing and available medicines to people who cannot access them because of inadequate infrastructure. Through the launch and implementation of the IFPMA's framework for action for NCDs, our industry has made progress in understanding what the key barriers are that need to be addressed in order to better prevent, control, and treat rapidly emerging NCDs in developing countries. The framework for action also enabled us to come to grips with some specific ideas to overcoming certain of the biggest challenges in addressing the NCD burden. Through the IFPMA NCD Research Series, we now have a broader understanding about how partnerships can be established and what must be prioritized. No one is going to be able to solve the NCD challenge in isolation, but we want to be clear that industry will not shy away from playing an active role in helping to overcome the significant challenge. So with an eye to the future, there is one other area where we hope the industry will continue to focus and build on its work to date, and that's innovation, as you heard from Eduardo, the theme of the conference, and much of the work that's being done. Clearly, it's the lifeblood of our industry, and ultimately, as for our reputation, the value of that innovation is only going to be as perceived by others. However, we believe that as an industry, we haven't done enough to communicate what we think that value should mean to our important stakeholders. Yesterday, we talked at the IFPMA Council, we talked about the importance of being proactive in this regard rather than reactive. First, I think it's important to acknowledge where as an industry we haven't done enough. In the current environment, healthcare budgets are under unprecedented strain, and the bar for innovation has never been higher. The failure to be honest where we haven't done enough undermines our ability to address the unmet medical need. Talking about innovations in terms of the costs associated with the difficulty of discovering a medicine and bringing it to market is not particularly compelling to many people. Frankly, at AstraZeneca, we discourage our leaders from quoting that statistic about how much it takes to bring a medicine to market. That number seems to escalate over time. And it seems fair that policymakers should respond to that comment by saying that taxpayers shouldn't pay for an inefficient R&D productivity model. It's also increasingly difficult to make this argument in the terms of economic stress. I mean, as tough as the economic pressures are in our companies, it of course pales in comparison to the challenges faced by European health ministers, policymakers, payers, and above all, patients in these times. So we think that, secondly, we need to rebalance that discussion about innovation. Within our sector, we think it needs to be described as how innovation benefits patients, how it enables the healthcare systems to become more efficient, and ultimately how it creates much wider benefits for society than just, quote unquote, enhancing our pipelines. So we applaud the work of those in the IFPMA's innovation work stream, as they know only by focusing on defining and delivering our innovation in these broader areas will we be increasingly viewed as a solutions partner for the wider healthcare sector. AstraZeneca is really enthusiastic about working with Dr. Lickletter, the Eli Lilly staff, Eduardo, the team at IFPMA, and all of you as we look to build on the program of the last 2 years. Before I leave, I really want to take this opportunity to thank Eduardo quite sincerely and the team at the IFPMA for the great work they've done in the past 2 years with David and the rest of those who work with you. I think you've made great strides, I think we all do, and thank you on behalf of AstraZeneca and all of us for the work you've done. Let me give you a round of applause before I move on. The global health issues we all face are serious, complex, and challenging, and there are no magic solutions. But our industry is blessed with many talented and passionate people. Our companies are committed to working hard with our many stakeholders to take on the threats that we all face. And as a trusted solutions partner, I truly believe that our industry will play an important role in finding the answers. By working together, we will prevail. I sincerely believe that. Thanks to all of you, and have a great day. Thank you.